your questions with regards to your sports injuries or your medical issues or the other things that you may be encountering during your training days. Tomorrow is the big race day. We at Sutter Health, it's the first time sponsoring the CIM and with the designated healthcare providers. We're super excited to be joining Sutter CIM and being part of this organization. So we have two sports medicine physicians and then 2 sports physical therapists here that are ready to answer some questions. So we want to be able to talk with you guys about how to prepare for the race, how to be ready to fuel for the race, as well as after the race. How are you going to recover? What kind of issues are you going to be? What kind of things are you going to work through as an athlete, as a runner? So, Paul, let's start with you. Okay, so tomorrow morning, it's going to be around 40 degrees. Runner's going to get dropped off an hour or so ahead of the race by the bus, by a friend, family, whatever it may be. They're going to be on the start line, warming up, getting ready. What should they do to get ready for the race? What kind of mobility exercises or what kind of warm-up routines should they do without overexerting themselves?
And so,
and Paul, introduce yourself real quick before you do that.
Yeah. So my name is Paul. I'm a physical therapist with Sutter here I'm the physical therapist here with Sutter in Sacramento in Midtown, and I work with a lot of runners and endurance athletes. We have it's going to be 40 degrees tomorrow, nice and cold, nice and brisk morning. And what's really important is just to get your body temperature up before you start your run. You don't want to be warming up in the first mile of 26.2. You want to already have gotten your heart rate up, feel nice and warm, and feel like as soon as you start going, you're already ready to start your race. You don't want to feel like you're trying to prep for the race in those first steps. You don't want to do a lot of static stretching, really slow movements that are going to cool you down. What you want to do is really do things that are going to amp you up and get you ready. Things that you do warming up for any other run. So I'll go through kind of a few little things here with you. We have a little bit of space. Usually I like to start slow, and then I'll usually start to pick up the pace a little bit as I warm up. So if you just want to start doing things, maybe like start to wake up your knees, wake up the muscles, walk through some little butt kickers. I usually do 5 or 10 on each side. When you're walking through the maybe pull towards your chest. Really slow things just like that. And then walking on your toes, wake up your calves, turn it around, walk back on your heels. And usually I'll do all these things maybe over the span of about 25 feet. It's really not too much. You don't have to go through a huge distance, but enough to get your nervous system activated on the muscles, get your blood flowing, get your heart rate up. And then from there, you can start to do things a little bit faster, right? So you might start getting into some running, high knees and butt kickers, a little bit faster, running high knees. Right? Start to wake up your joints, moving through a full range of motion. You can do some lunges, really get everything going. Reach your hands up overhead, right? So when you're running, it's not just your muscles that are working, not just putting a lot of stress on your bones. We're going to open up your airways, get your lungs moving. Really get your rib cage to open up when you're warming up for your run. So you're really starting to warm up the whole body, get your spine moving. And that's what I like to do at the start of my runs. You can start to get into some more ballistic stretches. You start to throw some kicks up, get your hamstrings warmed up, right? Get a little bit for everything, right? You don't have to do a million warm-ups. Pick 4 or 5 exercises that feel good. Things that can start to slowly build your pace, start to feel yourself break a sweat, feel your heart rate get elevated. So when you're at the starting line, that's not your time to get heart rate up. It's not your time to start your race. You really start your race before the belly moves up. If you have stiff joints, like stiff ankle, stiff knee, give yourself a little extra TLC again, right? So if your ankle is stiff, you kind of kneel down on the ground and just work on trying to, floss the ankle a little bit, work on getting that joint going. And you don't need to do a million of them, do 10, 15, 20, something to feel like that joint really gets loosened up. So maybe try to get your knees going a little bit more. If there's a curve nearby, again, put your foot up on the curve and just try to lunge into it. Warm up that knee so that when you start to push off for your run, you don't feel that stiffness in your first strides. It's already loosened up.
That's wonderful. Thank you so much. Yeah, so warming up is obviously super important for a race and for for athletes as they're getting ready to run 26.2 miles. During the race, and even before the race as well, there's an important element that we all need to be very mindful of, and that's how do we fuel our bodies. So Dr. Tavares, why don't you introduce yourself and then walk us through what are some good pre-race nutrition strategies, as well as during the race, what can the athletes consume to help prevent that rot gut or that GI distress?
Thank you. My name is Adrian Tavares, and I work for Sutter at the Alhambra location in Midtown along with Paul. And I want to talk about two things, and that's fluids and nutrition. And we're really economically at a disadvantage because as human beings with metabolism, 75% of our metabolism is wasted. It just gets burned off as heat. And so only 25% of our metabolism is actually energy. So compare that to a different type of animal like a wildebeest, where 62% of their metabolism actually gets converted to energy that they can use. So if you want to give somebody a compliment tomorrow, you can say, you are a wildebeest, because that's pretty economically advantaged. In terms of the things that we want to keep in mind here, when we're training, we want to be able to simulate the environment, the temperature, the humidity, the elevation that you're running in on race day, so that you can be at a very similar type of pace and sweat level and things like that. So ideally, we're going to run in and be able to do that ahead of time. And what we see in terms of the consensus is that if you can measure your body weight pre and post run on one of your long runs, you'll get an idea of how much fluids you need to replace based on the sweat losses. And then everyone's a little bit variable, but they say for more elite athletes, you want to have somewhere between 200 to 800 milliliters an hour of fluids, whereas for our more average athletes, it's somewhere between 400 to 400 to 800 milliliters an hour. So it's a big variation, but ideally you're replacing your fluids and doing it slowly and gradually. You don't want to take it in all at once and then end up having stomach upset. In addition to that, nutrition, this all starts before the race, of course. And in the past, we used to think that we need to really deplete our glycogen stores and just like run really hard, maybe like 2 weeks before and get all our glycogen out and then carbo load. But now the line of thinking is more that the whole week building up into your run, you want to have, you want to just increase your carbohydrate intake and be able to maximize your glycogen at that point in time. So, if you're going to go out to dinner tonight or gather with friends, ideally you want to have something that's kind of simple. You don't want to have too much protein. You don't want to have too much fat. You actually don't want to have too much fiber either, because all of those things kind of slow down the gut, and fiber can also increase your gut transit a little bit too, leads to things like runner's spots, which hopefully you're not going to have to deal with. With regards to the meal pre-race, you want to have something very similar. About 3 to 4 hours in advance of the run, you want to have something that you're used to eating before you train, something that is loaded with carbs, but not much fat, not much protein, just something that's going to be quick to absorb into your body and allow you to have the energy that you need to start off with. During the run, it's estimated that somewhere around 50 to 90 grams of carbohydrates per hour. And that's split up in about 15-minute increments. So you want to be kind of ingesting very slowly through the run. To give you an idea of what that would be, one packet of glue somewhere around like 22, 24 grams of carbohydrates. Banana is like 25 to 30 grams of carbohydrates. So these are kinds of things that you want to think about while you're running, trying to get in that carb so that you're not going to hit the wall. And that's when your body no longer has adequate glycogen or carbohydrate source, and now all of a sudden you're just relying on gluconeogenesis, where your body is converting protein and fat into carbohydrates.
Great. So is it too late to start carb loading?
It's not too late, but ideally you want to just kind of be carb loading all week.
Yeah. Okay. So all week leading up to the race, and then lots of carbs during the race, not too many.
Not too
Little
late.
by little. Got it. Incremental.
Georgia.
All right, Karina. You introduce yourself. And then also, so we have all these athletes out here. They're going to go run 26.2 miles. It hurts, right? And at the end of the race, you're going to have some pain. You're going to be, sore. What can runners do immediately after the race, in the hours following the race, to help with that soreness and to help them recover quickly?
All right, so I'm Karina Abrams. I'm a sports physical therapist from Davis, and I work with a lot of runners, and I've been in this event myself. And there's three things that we know are going to happen as a result of running a marathon. One is there's going to be some micro trauma and some signs of inflammation in the joint cartilage. Another one is that there will be micro trauma in the soft tissues, the muscles, and the tendons that are propelling you and controlling your movement through your run. And then the last thing is that there's just this general inflammation that happens throughout the whole system. So the question is, what do we do about it? So the first thing, and I hope that the joint inflammation is not excessive, but the best thing that you can do for that is just change the load, change the stress on your system. So after all the training that you put in to get yourself here, and then whatever happens tomorrow, the stresses on the system need to change. So my suggestion, after having helped a lot of runners through a lot of injuries, is to give yourself a few weeks of low to non-impact training, so that because you've been doing a lot of high impact, the impact causes stress to your joints. So make sure that decreases as quickly as possible. We just need non and low impact training for probably a few weeks. My conservative suggestion would be give yourself the rest of the month to do something that's less impactful than running. The second thing is the soft tissue micro trauma that will happen. And most of the time, what that feels like is everything feels kind of tight. There's this residual tension that happens in the muscles when they go through that type of stress. And usually, the general feeling is that you're just kind of tight and then you want to stretch. Stretching sometimes feels good, but it doesn't tend to help recovery in and of itself. So using tools like foam rollers and sticks, those self-massage tools can really help. The problem is the research doesn't tell us exactly what to do with it. There's not a clear answer as far as how much pressure you use on which part of the tissue for how long. What we found anecdotally is that flushing, so like rolling along the whole length of the muscle first, to kind of like that helps you feel like you're getting a massage, and then you can find also the spots that need more attention. Then you let the focal pressure sit on those, so it'll be like a static pressure on the tender areas, and then you move while you're doing that same foam rolling. So or using a stick massage tool. So kind of flushing the whole tissue out, and then letting there be pressure on a sore area. Following that with movement, with the pressure still on the sore area. So if I'm rolling my quads out, say I've got a massage tool and I'm rolling my whole quad out, and then I find that the spot right in the middle is the sore spot. Then I leave the pressure on that spot, and then I move the thing that's one joint distal and further away than that tool. So the roller is here in the middle of my thigh, then I just move the knee, and it feels like massaging the sore muscle. Massaging the sore muscle. And then after that, the conventional stretching, the systemic stretching that you're used to using for your recovery tends to work a little bit better because the tissue is a little more prepared for it. There's less residual tension and the stretching will actually work well. The last thing is the inflammation, which will happen with running, even with short little runs, especially after tomorrow. So the common thing with inflammation with musculoskeletal injury. The common thing that people think of with inflammation with musculoskeletal injuries is we better put some ice on it. So if something's inflamed, we want to put something cold on it. And that's fine. It does tend to work. So the question is, do you book cryotherapy for your whole body for Monday? Or do you do some kind of cold water immersion where you put an ice pack on? And the short answer is yes. Any of those things can help. And the research doesn't really show us one answer is much better than the other. Whole body cryotherapy has been shown to be a little harmful to the muscle in terms of some of the markers of inflammation, and it's also, but it also tends to help athletes feel better. And cold water immersion, like just going in and getting in your unheated pool in December, can also help you feel recovered sooner. But again, but the research doesn't show us that there's a substantial decrease in inflammatory markers or a substantial increase in muscle function as a result of any of these cold therapies. But the most important thing is how you feel. And if you feel like it helps you recover faster and you feel better after having done these cold therapies, then you should do. The placebo effect is really big. So even if there's not a physiologic or kinematic effect of these cold therapies, if it helps you feel better, it works. And that's important. You've got to feel better. The other thing that I think we're also going to touch on is rehydrating yourself. Because even if you follow all the great things that Dr. Tavares talked about in terms of hydration and energy consumption during the race, most of us are severely dehydrated even in a cold environment. So after a race like that. So recovery things are move your body gently, do some self myofascial release with foam rolling and sticks and things like that, and get something cold on if it helps you feel better.
Great advice. Thank you. We'll get to questions in just a minute here, okay? Yeah, absolutely. We'll definitely be taking questions from the audience here. But first, I want to get to Dr. Yee. So we've heard about getting ready for the race. We've heard about some nutrition strategies and fueling and hydration during the race and then post-race as well. But one of the things that, as a runner myself, I've always struggled with is identifying when is racing in pain not okay. So during the run, sometimes it's, we're all used to pain to some degree or another. But sometimes it's hard to know, like, is this pain good or is it bad for me? So can you talk to us a little bit about how we can, what kind of recommendations you have for us, that for the audience, the athletes, to be able to identify when is that pain a bad sign for us, and when should we be stopping or modifying our running activities?
Thank you. That's a really good question. My name is Chill Yi, and I'm a sports medicine physician, but also have an unusual background in acupuncture and integrative medicine. So I work with a lot of athletes, including runners like yourself. I'll give a great example of two runners I've treated here, actually related to here. One person who developed a hip stress fracture, and she had to stop. And so I think this is where it's important to find not only a coach to help you train, but a physician to help you say, hey, this is an unusual injury. You might want to stop because you're going to have some trouble going into the race. Well, what about during the race? You don't have a partner there. You don't have a physician. You don't have a coach there. You have to make some decisions. By now, you know the difference between muscle ache and deep joint pain. If you have deep joint pain, that's tough. It's tough to say, should I quit or should I modify? Maybe slow down the pace. Maybe slow down the cadence. Maybe do a run jog. Maybe just walk. Or maybe this is not for me and we'll go like run St. George or Oakland Marathon instead and recover. So my advice is if you're there alone, you have to listen to your body. If you train for months and months, I think by now you know the difference. But it can be quite severe. So the severe part is I have seen patients where they literally break their bones. They break their hip joints, they break their feet, and then they need surgery. So that's pretty significant just from running. It is possible. So let's fast forward a little bit. So you go through this process, and maybe you compromise, and maybe you finish the race. To dovetail off what Karina said, one thing that does happen to your body, which you may or may not recognize, is probably every single person here will get rhabdomyolysis. What does that mean? You have muscle breakdown. Muscle breakdown, which in normal circumstances is not a problem. You drink lots of food, very important. And it flushes out those byproducts and it keeps your kidneys healthy. Unhealthy people or dehydrated people can cause significant kidney disease. So one helpful tip is not just if you sustain injury before, during, but something you may not recognize is after. So that's important as well. Well, let's fast forward a little bit. Well, okay, I just finished a race. What if you do develop injuries? How do you take care of this? I hope that you have a physician ally, a partner that helps you walk through that and say, hey, this is how we recover from this injury. This is how long it's going to take. What about pivoting to some of the things that I do? Acupuncture or alternative medicine. I'm not an expert there, by the way. We can help you with that. And not to give a plug for Sutter Integrated Power, we do have integrated health practitioners, chiropractors, acupuncturists, massage therapists. So if you're seeking alternatives for your care, there's plenty of avenues to pursue. And not everyone's from Sacramento. There's integrated health centers across the United States that you can tap into as well. So circling back to the injury, please listen to your body. If you feel like you're sustaining a different joint pain, it's a hip joint pain, knee joint pain, significant foot pain, we do have medical personnel across the base that sometimes can help offer advice as well. I think that's good for you.
Yeah, thank you, Dr. So just as a quick plug, just to tag on what you're saying. So Sutter Health is the official medical care provider for the CIM. We do have our trained physicians as well as physical therapists and nurses and other medical staff out in the finish line. We have over 100 individuals that are going to be there to serve your guys' medical needs should they be needed. And then we also have in race. We have healthcare providers throughout the course as well to help you guys if you have that need. So going back to you again, or either one of you to Dr. Tavares or Dr. D, sometimes it's hard for the runners to know, like, is this pain okay? So you're experiencing the pain, you're not sure if it's going to worsen or if it's going to cause a permanent injury or a really bad injury. What recommendations do you have, just to be very specific about? So we're at mile 15. We have another 11 miles to go, and I've got a calf pain, or I've got pain in my quad or my knee. How do I know? Like, how does the runner know if they should not be continuing on the run? Are there signals or are there things that we can help them with, or that you can recommend them to identify?
I'll just say, as a sports physician, I see a lot of runners, and a lot of times they're not too eager to come in and see me because they think that they're just going to be told not to run. And what I try to tell them is that my job is to get you back to running and enjoying it and being able to run pain-free, not to tell you not to run. So one of the things that I would focus on is just the intensity of the discomfort, and is the intensity progressively increasing as I continue to go forward. And if it does increase, then I really need to listen to my body, slow down. Maybe I'm not going to have that 8-minute mile pace that I was hoping for, but can I do it in 10-minute miles? And if it feels okay, then keep going. But if it's still hurting and it's getting worse and worse and worse, and there's nothing I can do, you just gotta call it quits.
Yeah, that's fair. That's fair. You have anything to add, Rita? So you were nodding your head there quite a bit.
I'm disagreeing. The other thing that sometimes is a way to kind of self-assess while you're running. If the feeling that you have, the discomfort that you have, feels very general, like it's diffuse, like your whole leg kind of starts to ache, that may be, or especially if it's both legs. If it's more diffuse, it's probably maybe a sign that you need to slow it a little bit, or maybe take a walk break, but that it's probably just a response to the stress you're putting your body through, as opposed to something that's much more specific. If you have soreness developing on the inside of your knee, for example, that is very persistent, that's more likely an injury than a normal response to the fact that you're running for so long. So it doesn't always work. It's not a foolproof rule, but if it's general discomfort, kind of like an aching, it's a whole area that's less likely to be serious, than something that's more specific.
Thank you.
Awesome. Thank you very much. I know that there was a question. Did you have something to add, Dean?
Oh yeah. Haven't been a runner and not getting this guy advice and glycogen loading and hitting the wall at mile 20 and having cramps. That's very painful. But to what Rena said, generalized pain, less likely to be your joint. One helpful hint that often people mistake a groin pull, chances are if you're at mile 15 for that groin, it's likely your hip joint. So if you're having that can be very serious. And it's very hard for you to tell the difference between a groin pull and a significant hip. They overlap. They feel the same. So this is where the compromise happens. It's like, well, you can try. You know, slow down the pace, do intervals, maybe walk, run, and then see us at the middle. We're there, 9:26.
Awesome. Thank you, guys. I know that there was a question in the audience right over here. Maybe we can get a few questions from the audience and see where this takes us.
Thank you. My question is when should you introduce a heat therapy?
So the question is when should you introduce heat therapy?
Really, ice and heat are powerful pain modalities. So generally when things are inflamed, which is immediately like the rest of the day tomorrow after you're done running and probably into most of next week, there's an inflammatory response going on. Our bodies create heat as part of that process, so we don't tend to think about putting heat on it. However, things tend to move a little easier when they're warmer. That's why we warm up. That's why Paul went through that great dynamic warm-up discussion about preparing the tissue for the stress you're going to put on it. So if you're planning on doing a light workout as a recovery thing next week, and you either dynamically warm up your body physiologically, or sometimes if you feel a little better, a little looser after getting out of a hot shower, for example, maybe that's the time to do some stretching. So it's not going to cause more damage to put heat on tomorrow or the next day. But and like I said before about the ice and stuff, we tend to think about ice when things are inflamed, but the actual physiological and biomechanical recovery that goes on with cold is also either negligible or debatable. So it's really about what makes you feel better. So that's not a good answer because I didn't answer your question. You said when do you start heat, and it could be if you feel like putting something. If you're feeling stiff and you want to take a hot shower tomorrow night, you'll probably feel pretty good, and then stretching after that is good. You really start your recovery process.
It's like a sauna,
Sauna right afterwards?
Not like after.
Well, I mean, it could be therapeutic for you to enjoy sauna. Right afterwards, I would recommend it. To run the random, real. Everybody will get it. It's muscle breakdown. You can help it. You run 26 miles, your muscles will break down.
So saunas will dehydrate you, right? So you want to hydrate as much as you can, especially the first 24, 48 hours. Okay, so transitioning a bit, we're obviously day before the race here, so we only have 17-ish hours before race start. But sometimes runners during their training journey to the start line end up injured, and sometimes they can break from running, or they have to alter their running, or they have to look at a different, cross-training activity. What recommendations or strategies have you seen to be successful for the runners who end up injured during their training cycle leading up to a marathon? So now they're healthy, right? But what strategy have you seen to help them get through that injury, and then also to be ready on race day? Any ideas?
So one thing I always like to tell athletes I work with is the two greatest lessons I've learned as a therapist is you can't tell a CrossFitter not to CrossFit, and you can't tell a runner not to run in those circumstances. And so when you're going through this training, everyone's heavily invested, endless hours and a lot of resources into your training. We really want to say, like Adrian said, how can we get you back to running? How can we keep you to continue running to meet your goal to hit those 26.2? So ultimately, when someone gets an injury during their training, we really just have to have a realistic conversation and say, what are your training goals? How experienced are you as a runner, and how realistic are the goals that you set? You might need to just reevaluate your goals so that this marathon you can finish successfully with maybe some reestablished goals that can meet you where your body is. So if you're getting an injury that could be related to maybe you're overdoing it with your training intensity, ramping up, you're going too hard, too fast, or too much. That's usually where a lot of training injuries and overtraining injuries would come from. You say, okay, are you going too fast, or are you doing too many miles out of the gate? What do you do? So we usually will say, let's just modify your training so that you can continue to go if we can do that in a way that reduces your pain. Pain may not go away immediately overnight or at the moment, because sometimes it does take several days or a few weeks for your injury to go away. We want to modify your training to create a positive trend so that your performance can continue to improve and your performance doesn't start to deteriorate. So that could be something like changing your pace. If you've been training at 7:45 pace, maybe you could say, hey, maybe like 8:30, 8:45 pace could be enough to change your training so that you can hit your goal and still finish the race. The ultimate goal is to finish the race. Maybe you don't do as many speed workouts. Maybe you do a fewer, some more easy days and not as many high intensity training days, so you can actually recover from the race and show up to the race and be successful. And also, don't skip your taper. There are recovery weeks and there are taper weeks in your race because they're designed to allow your body to recover through that entire process. Because most of you have done a 16 to 18 week training program, plus your base building. You're all in it, you're all invested, and you just need to make sure you're giving your body the recovery through that process.
Anybody else got anything to add?
It's fantastic.
Comprehensive answer. Yeah. All right. Any other questions from the audience? Yeah.
These straps. So a lot of people use these straps.
So should the runner take Motrin? And then what about knee straps? So knee straps are you thinking what's below the knee? Patella belt? Yeah, on the kneecap. Okay. So knee straps below the kneecap or on the kneecap. And you guys want to handle that? Yeah, once you guys take the Motrin, you do the Motrin one real quick. Yeah.
In terms of Motrin, I mean, you just want to think about that concept of rhabdomyolysis. So what's happening in the body during the run, where your muscle is breaking down, you're dehydrated, so your kidneys are working harder to flush the system. So they can't handle a whole lot more insult on top of that. And when we take ibuprofen, it plays hard on our kidneys. So during the run, ideally, you don't want to be taking any sort of non-steroidal anti-inflammatory, but afterwards, once your hydration is replenished, that's fine. And we prescribe it. We're looking at 600 to 800 milligrams up to 3 times in a day. But over the counter, say 200, 400 milligrams at a time is okay as well.
Tyler would maybe say that injuries.
As far as the knee strap question, generally the type of straps that you see that are kind of like going right around the knee, there are a couple of reasons people might use them. One would be like you have patellar tendonitis, which is an irritation of the tendon where the quad attaches to the shin. And the strap is usually put kind of between the kneecap and the shin, so it's right below the joint. And it's the theory is that it's deflecting some of the stress through the tendon so that it doesn't hurt as much to do the stressful activity. That's why you see people running with them on or participating in various sports with them on. If it's placed right on top of the kneecap and there's a lot of pressure on it, that probably wouldn't be right. It seems like it might be a bit progressive to the patellofemoral joint or right in front of the knee. But generally, those are either placed below the kneecap for that tendonitis, or they may be above the knee joint to address an IT band friction syndrome. So.
I'm a big fan of the KT tape heads like that. The strap can be irritating, so it might be more comfortable. I send you the useful tapes.
So the KT tape would be used for another type of condition, which is more of like what we call runner's knee, which is patellofemoral pain syndrome, where your kneecap is not sliding appropriately in the groove where it's meant to slide up and down. And so the tape is supposed to kind of keep that knee sliding in a vertical direction and not kind of going off to the side.
Excellent. Thank you.
The KT tape, the tape, kinesiology stretching tape in general can also be used in terms of recovery. It changes the sensation that you get from sore areas. So it definitely helps with discomfort during an event, and it can help the perception of recovery also. So the sore muscles is like that.
Just one more thing to give a little add-on for the KT team as well is that because the tape it has a little bit of tension when it's on your skin. When people are thinking about what can I do to help with some of the inflammation, maybe your joint feels a little bit swollen or the muscles, maybe the muscles are swollen from the inflammation from the rhabdo, like they've been talking about, is when you put the tape on, it creates a little bit of a tenting effect on your skin, so it actually helps enhance a little bit of fluid circulation. So it can help with the recovery after the race as well, because it does help the body circulate the fluids through, and also just help improve your fluid metabolism. You get a lot of those kind of muscle breakdown byproducts and things out of the system as well. That's one more part of the theorized part of the PTs as well.
Excellent. You all answered that one. That's great. One final question. Since you guys are with the designated medical providers on course as well as after course or at the finish line, what happened? The unfortunate circumstance, someone sprains their ankle or they fall and hurt themselves. What should they do during that when that happens? So who should they talk to, like on course, and then also what should they do to support that ankle sprain right immediately after it occurs?
We do have volunteers at each aid station. There is medical personnel. So if you get into trouble along the course, ask for help. So beyond that, let's say you specifically had an ankle injury, we do have supplies in the medical tent that we can help you with, whether it's sprained legs or even minor splinting you have available, or after you fall and you have a laceration. So if you make it to the medical tent, we will make those decisions based on your injury. But if you're in the race, your best bet is to go to the aid station.
Excellent. Thanks. Everything else after that one? Okay. All right. Any other questions from the audience? We have 2 physicians here, 2 physical therapists. Yeah, you got one?
My neck sometimes gets very intense and tight. It starts to hurt. It's start that's when I run after a long period of time. One, have you seen this before? And second, is there anything you can do while experiencing that to relieve some of your pains by doing so?
So I've had the same thing. So the muscles that are supposed to support, like they're supposed to move your head, usually when we're running and we're bouncing for a long period of time, those muscles also start to have to hold your head up. So then they just they're overworked, and especially as the rest of your posture gets kind of tired, you're kind of slumping like this, but you're still looking forward at where you're going. The muscles just get overworked. And so my suggestion is, which may not be a great piece of advice on race day, but when you start to feel tension or discomfort before you feel like it's hard to hold your head up, or like it starts to move in a way that you're not intending to. So when you're starting to feel tense or a little bit uncomfortable in your shoulders, upper back, neck area, then I would tell you to pull your shoulders back, stick your thumbs out behind you like a hitchhiking, to tuck your chin in like you're trying to make a double chin, and then lengthen the back of your neck just like that. You like that for maybe 5 or 10 seconds. Like if you were just like driving or sitting at your computer, I would say just take a couple of deep breaths in that position. If you're running, it's a little bit different. It might be like 5 or 6 steps, right? And then do it like every mile. Once you start to notice that discomfort, so that it doesn't just get worse and worse and worse as the race progresses, or as your training, whatever it is, progresses. If it feels like it starts to continue to get worse, then I would say you got to stop and you got to walk, and then you can keep yourself in that position for longer, so that when you start running again, the muscles that are supposed to be helping hold your posture up are the ones that get probably getting tired and you run like this, which is what we all tend to kind of look back towards the end. So if you can get yourself up and get your shoulders back a little bit and get your neck into a better position, and kind of reset, kind of remind. So the way I usually describe this is the brain is trying to kind of remind the muscles what they're supposed to be doing. Kind of reset your posture, and then when it feels like it's starting to fail, then you fix it before it really fails.
I'd say that part of this can be a biomechanical issue, part of this can be a degenerative issue, previous injury, lots of things that can factor into this. But one of the things I like to explain to people is the average human head weighs about 12 pounds. And for every inch we keep forward, when we get to this point, it's like putting 40 pounds of pressure on our neck. So we've effectively quadrupled that force on our neck. And so our muscles are not able to accommodate that excessive load. So one of the things we would have you work with these guys on is your posterior chain and getting things straightened so that you can run upright posture. The same thing happens to a lot of us just as we're hiking on our next system too.
Good one. If you have alarming symptoms, pain that extends to your arm, that could be a problem. It implies a pinch nerve, in which case you could split it apart. It would help you.
Yeah, so they're kind of like everyone said, it connects to your postural fatigue in most cases. Not every single case, but in a lot of cases, as all the postural muscles will be fatigued and your body starts to get bored. So what I'll usually tell a lot of my runners is not just pick your head up, I say pick your chest way up. Really try to pick up the whole upper body. It's also going to open your rib cage a little bit more, so that way it'll help reduce a little bit of fatigue and you're going to enhance your oxygen exchange for your body as well. So keep your body supplied with better nutrients. It'll help with that. One tip I give runners with longer hair that often have their hair up in a pony when they're running, notice how much the pony swings when you're running. If it's bobbing all over the place, your head's probably bobbing a lot with it. If it's a nice, easy kind of bounce when you're running, that's probably a nice, more biomechanically efficient running stride. So that's a tip that I'll give runners that have longer hair that usually tie it back. That's kind of a way to know how much you're kind of bobbing around. Yeah, you don't have to worry about this one, but yeah, so that's usually one extra like little tip I'll tell people if they're trying to wonder like how much am I kind of bobbling when I'm running and keeping my body pretty steady. It's going to pay attention to how much you feel kind of the swing of your hair. Is it kind of bouncing all over the place, or is it a nice kind of easy bouncing that stays with you guys kind of bobbling?
Excellent. Hopefully that answered your question, Sam. Great. Absolutely. Thank you. Thank you all for joining me for this panel here. Look forward to doing this again next year, the year following, as Sutter Health continues to sponsor the CIM and be part of that, be part of this organization. So look forward to seeing you guys out there tomorrow morning, bright and early, and then look forward to seeing you across the finish line. Thank you all. Sutter Health.